Good afternoon. My name is Gregory Pope, founder of SpinalSurgeryMexico.com. Today we're at the hospital Star Medica here in the city of Querétaro, Mexico. My patient that is here, his name is Don. He's 67 years old from Canada, and he came to have a lumbar surgery done with Dr. Salmon. Thank you very much for watching the video, and I think you'll find it very informative. Thank you.
We already discussed your case with my partners.
Right.
We have 4 associates, neurosurgeons, everybody, and they're going to be here tomorrow also. My team is a compound of 4 neurosurgeons, my anesthesiologist, which is also an internal intensive care specialist, and 2 scrub girls. That's the whole team, okay? We already discussed your images and everything, and the plan is to do the foraminotomy from L2 to S1.
Okay.
All levels, okay? And once we are there, we're gonna check for stability and to be sure if you need the screws or not.
If we need to, stabilization. Okay.
That's the fun. Your pain is worse on your legs or on your back?
Today it's in my back, but it's usually here and then down, and then the soles of my feet.
Okay.
Yeah,
Okay.
really
The main goal of surgery is to decompress the neural tissue. So you can feel the results just after going out from the OR, because you can feel the change in pain, for example. If you have pain after surgery, immediately you won't feel pain. Radicular pain on your legs, okay? You're gonna have, of course,
Incision
pain in the incision, but that's temporarily. So it will last like every day.
It gets better.
It gets better. Yeah. The main goal is to decompress the neural tissue, and the translation of that decompression is the pain goes away. Okay. Some patients after the decompression, because of the manipulation of the nerves, can have some numbness in some parts of the legs, but it's temporarily also. Okay.
Well, and it's I've had pain for 40 years.
4 years.
40 years.
40.
40.
Wow.
Yeah. They started when I was 27 years old was when I had my first back injury, I guess. And they told me at that time, they used the same words I've heard ever since. You have premature disc degeneration. You're not a candidate for surgery.
27. Hello there, I am Dr. Salmon from Mexico. I'm here at San Miguel de Allende, came to pay a house call to Don, which was operated like 13 days ago, I think. And I'm here to see how he's doing. Well, I know how he's doing because I have talked with Claudia, the physiotherapist, and Greg Pope every day about the outcome from the surgery. He has said that he's very comfortable with the results. The clinical picture he had before surgery has changed a lot, and I think he has said that he's happy, and we're happy too. So thank you for watching the video.
Hi, I'm Marlene, Don's wife, who had the back surgery here at San Miguel. I can't impress upon anyone the great care and the lovely holiday I've had. Between the doctor and Greg and our physiotherapist, it was tremendous. When we got to Star Medica in Querétaro and were escorted to our room, and there was a nice bed in there for me, and there was lots of room. You didn't feel like you were in a normal hospital room, and it was very comfortable. The staff, it was never one person that came in, it was always more than one, and they were very good with the translation, and we knew what they were doing. And I would not hesitate to recommend coming here. It's a beautiful town, and thank you for giving me my husband back.
Hi, I'm Greg, founder of SpinalSurgeryMexico.com. Dr. Salmon was just here to check on Don that had lower lumbar surgery. Don's surgery was very much a success. There was a debate whether it was going to be some rods and screws involved or if it was just a decompression situation, and Dr. Salmon really wouldn't know till he got in the operating room and he was able to decompress everything. And at that point, when Dr. Salmon actually, the integrity that he has, he did not use rods and screws because it was not necessary. Some surgeons might have done that and just did not have the integrity. And me and Don have talked about that. And I think that at this point, I would like for Don to say a few words about his experience here in Mexico and whether he thought he made the right decision coming and how he likes San Miguel and the hospitality he's received here. So at this time, I'm going to allow Don to expand on his experience here.
Great. I think it was January. We talked the first time. Late January. Well, middle of January, I guess. I had seen a surgeon in Alberta who had, first words out of his mouth were, in 10 years, you'll be in a wheelchair, but you're still not a candidate for surgery. We got talking about artificial disc replacement. We got talking about rods, all the rest of these wonderful things. And so we made a decision that we were at least going to investigate what the costs were and what kind of procedures. So I sent an inquiry off to Germany. I sent one off to Thailand. I sent an inquiry to Greg. 20 minutes, not even 20 minutes after I send off my inquiry to Greg, the phone rings. And it's Greg saying, "What can we do for you? How can we help?" So we sent the pictures down that I had had to pay for my own MRI again. In Canada, an MRI will take you 8 to 10 months to get one. And if you have a complication, you're going to wait another 8 to 10 months to see a surgeon. So it just wasn't viable for me to do that. So we finally managed to get the documentation down here. In the meantime, I had heard back from Germany. Germany, their intention was to open me on the front and put, is it an M6 disc?
M6 is what they...
An M6 artificial disc in through the front. Then they were going to flip me over and they were going to permanently fuse the 2 discs above that. And then I was going to get the partial fusion for the 3 discs above that so that there would be some movement in my body. The grand total in Canadian funds was $223,000. Yeah, like that's not going to happen. Thailand got back to me and said that they were willing to fuse the thoracic 12 and the L1, and then maybe with 2 or 3 years of physio, the pain might stop. In Canada, I could not get this surgery done, period. Didn't matter what I had for money. Europe, we were looking at $225,000 Canadian. The United States was going to be probably 300 plus. And my actual costs were approximately 1/7 of what it was to go to Europe. I come home without any extra materials, without any extra pain or concerns about what's going to happen in the future. Yeah. The costs are so affordable that if you do not check out this place and do your homework, compare it to what other places are asking and what other places are offering. And you're going to find that the surgeries are less, the accommodations are incredible, the community is unbelievable. What more can I say? And the information went to Greg, and within 2 days I had a report from Dr. Salmon saying that we will do basically going to roto-root the nerve canals so that the nerves are not being impinged any longer. And as Greg said, make a decision at that time whether or not I needed to have a spinal stabilization done. Either way, I was still going to have stability when it was finished. My wife and I made a decision that we were going to try and make a bit of a holiday out of this, so we came down 5 days early, and we stayed in a beautiful hotel in San Miguel. And on the morning of my admission to the hospital, Greg came to the hotel, picked us up, drove us into Querétaro, and sat with us until Dr. Salmon was able to get a hold of, or was able to come down and discuss with me what was going to happen and how many people were going to be there, what their qualifications were, which was beyond belief. And in the meantime, I had also vetted Greg and the company and Dr. Salmon, and I could not find a negative comment anywhere online. Just didn't exist. It was almost like too good to be true. Yeah, it was unbelievable. So they took us up to our room. The next morning they came in, grabbed me, took me down to the OR, and when I come out of the anesthetic, I could feel my feet. First time in years. It was an unbelievable feeling. I've been told for 40 years that I had a condition called premature disc degeneration, and I was never going to be considered a candidate for surgery. And when I told Dr. Salmon, he shook his head and said, I don't understand it. The best that we can determine is that in Canada, I don't think we have the caliber or the quantity of neurosurgery that we have down here. I would never have had surgery with 4 neurosurgeons in the room working on me at the same time.
And Dr. Salmon being FACS, fellow of the American College of Surgeons.
Surgeons, yep.
Wonderful award that was
Yep.
bestowed upon.
Well, and the hospital itself, I have no idea what to expect. And I go into a hospital that carries the certifications and credentials of the Mayo Clinic in Mexico. Wow, what can one do? They had me up walking the next morning. Dr. Salmon came in and said, you're good enough, you're going out to San Miguel in the morning. And I looked at my wife and said, really? Here we go. We have not been looked after. There has not been a moment when I have felt that there was not somebody there in the event of an emergency. You came over daily to check on us. Pat was always talking to us when we went by. It was just an incredible experience.
Well, I try to give you as much privacy as possible, but yet I still want to check on you to make sure that everything
definitely
is going okay.
But I feel like I don't think we got a friendship. I think we got a family.
Absolutely.
Absolutely.
You'll always be a part.
Yeah, between you guys and Dr. Salmon and Claudio, unbelievable. Unbelievable experience. Don't want to go back to the snow and ice, but it has been a pleasure.
Don, I can't thank you enough for giving me your testimonial, and we're very happy to help you. And at this time, I would like to say that if you know anybody that we can help, we'd be more than glad to try to help you in any way possible. Please contact Gregory Pope at spinalsurgerymexico.com. And I have a contact form on the webpage. You can send me an email, or the phone number's on the website, and you can give me a call, and we'd be more than glad to try to help anybody that we can. Thank you very much for watching the video.